Welcome friends, today we'll discuss about non-cardiac surgery in patients with heart disease. Non-cardiac surgery, particularly major vascular, abdominal or thoracic surgery, can precipitate serious perioperative cardiac complications such as myocardial infarction and death. In patients with coronary artery disease and other forms of heart disease, careful preoperative cardiac assessment may help to determine the balance of benefit versus risk on an individual basis and identify measures that minimize the operative risk. A hypercoagulable state is part of the normal physiological response to surgery and may promote coronary thrombosis, leading to an acute coronary syndrome in the early postoperative period. Patients with a history of recent PCI or acute coronary syndrome are at greatest risk, and whenever possible, elective non-cardiac surgery should be avoided for 3 months after such an event. When possible, antiplatelet agents, statins, and beta blocker therapies should be continued throughout the perioperative period. The table shows major risk factors for cardiac complications of non-cardiac surgery. Recent, less than 6 months, myocardial infarction or unstable angina, severe coronary artery disease, left mainstem or three-vessel disease, severe stable angina on effort, severe left ventricular dysfunction, severe valvular heart disease, especially aortic stenosis. Careful attention to fluid balance during and after surgery is particularly important in patients with impaired left ventricular function and valvular heart disease because vasopressin is released as part of the normal physiological response to surgery, and in these circumstances, the overzealous administration of intravenous fluids can easily precipitate heart failure. Patients with severe valvular heart disease, particularly aortic stenosis and mitral stenosis, are also at increased risk because they may not be able to increase their cardiac output in response to the stress of surgery. Atrial fibrillation may be triggered by hypoxia, myocardial ischemia, or heart failure, and is a common postoperative complication in patients with pre-existing heart disease. It usually terminates spontaneously when the precipitating factors have been eliminated, but digoxin or beta blockers can be prescribed to control the heart rate. Thank you, friends.